and welcome to Rural Health Matters. I'm Christina Loren. Although the number of COVID-19 cases is declining in most big cities, new coronavirus hotspots are cropping up along the rural countryside in areas that have been spared up until now. Joining us tonight from the University of Nebraska, Omaha, is world-renowned Dr. Jeffrey Gold, the Chancellor of the University of Nebraska Medical Center, and Nebraska Department of Economic Development Director Tony Goins joins us tonight as well. Thank you, gentlemen, for being here. Dr. Gold, let's start with an overview. How widespread is COVID-19 in rural America?
Well, Christina, first I want to wish you and the entire RFD family and all of our viewers the very best of the Labor Day holiday, and thanks for the opportunity to be with you tonight. Unfortunately, we continue to see a significant amount of spread of COVID in the rural communities. If we look at the first graphic, which is our United States numbers, as our audience probably knows, we're well over 6 million confirmed cases and 186,000 confirmed COVID-related deaths. And the overall rate per day continues to tick around 35,000 to 40,000 new cases per day. But as we see in this next chart, the numbers continue to shift away from the coasts and the southern states and more towards the central part of the United States, and not just to the big cities, but unfortunately to our small rural communities, our farming and ranching communities. If we take a look at this next graphic, you can see some of the states across the country where the largest upticks have been over the last several weeks. And what you see, South Dakota, Iowa, North Dakota, Alabama, other states that are the breadbasket of our country that had been relatively protected during the entire 6 months of the rapid spread of this pandemic virus, are now starting to see brisk upticks. And it's not just in the larger cities, but unfortunately, it's in our rural and it's in our smaller farming and ranching communities. If we take a look at the next graphic, I think you'll get an idea that we saw a peak of the viral spread on a day-to-day and week-to-week basis going back to early March in mid-April. And that peak really related to the spread in the Northeast, and we all know what happened in New York State and in New Jersey and Connecticut and other parts of the country, in Washington, in parts of California. We saw a slow decline over the next month or so, and then around the beginning of July, as the non-pharmacologic interventions began to be opened, as the weather got warmer, as kids and others started to venture out further, we saw a pretty steep uptick and then a bit of a decline. But for the last week or two, we've had a very flat level of cases. And that's been reflected here in this chart that looks at death rates. And those death rates are unfortunately not coming down in spite of the fact that we've seen lower hospital mortality, fewer ICU admissions, and fewer patients having to be placed on ventilators. And this flattening of this part of the curve has been specifically related to the continued spread of COVID-19 in the rural communities across our country. And so there's no question that we need to maintain that awareness and that vigilance in terms of controlling the spread.
Absolutely. On this Labor Day as well, so many people now without a job because of the impact of COVID-19, which is why it's so wonderful to have Tony with us. Tony, you're with the Nebraska Department of Economic Development, and we all want to be optimistic about the economy, but at this moment, jobs are being lost, companies are seeing business slow down, some may not even come back, and our farmers and ranchers, they're hurting. How does somebody in your position look at what can be done to help reverse some of these trends?
Well, I think our challenge is the same challenge that everybody's having across the United States. I would say that optimism is extremely critical, and we remain optimistic, but we have to look at the situation really throughout all of our territories. I mean, there are different industries that are in different places. So in terms of looking at reversing the trend, I think we still have to optimize the stimulus that we have coming in through our system. I think businesses have to focus on doing business with business. And we have to continue, as we have done, to focus on growth. And that means looking at bringing high-paying jobs to our state, look at business expansion. And I think it's irrefutable that the vaccine will help bring some level of confidence so that our consumers feel comfortable going into restaurants and establishments. So I think a combination of all of those are things that we have to just really stay the course. It's not going to be easy. I mean, this is not going to happen overnight. A vaccine won't happen overnight, but if we're vigilant and understand that we can't, what I call, really just stop living. I mean, we have to make sure that we keep the health of our citizens top of agenda. The governor always talks about looking at capacity around hospital beds, ICU, and our ventilators, and we have to keep those statistics in front of us. But we also have to think about the health of our economy and making sure that our citizens have a chance to take care of their families.
Absolutely. The economic health of this nation can lead, in some cases, if your finances aren't healthy, all that stress can trigger medical issues. So we do want to make sure we're looking out for everybody. And that's why we love having the two of you joining us tonight to take viewer questions. And our first question comes from Dave in Wyoming. He says, how close are we to developing an accurate at-home coronavirus test? Rural residents like myself would like to have one on hand for flu season.
Dave, I think what you're asking for is the goal of all of the testing. We need a high quality, meaning sensitive and specific test for COVID-19 that can be done at home quickly and reliably. And, think about the day that we'll have a card or a kit that you can place some saliva on and within minutes have either a red line indicating you need to call your healthcare professional or your local public health district, or a green line that says go to work, go to school, go to church. And there's a lot of research being done, including in our own medical center here in Nebraska, specifically to develop the technology to do that. Abbott Labs recently made an announcement of a point-of-care testing kit based on what's known as antigen testing, which will be based on a quick nasal swab that should be able to produce high-throughput, rapid turnaround at an affordable rate. Yet to be shipped, but there's a number of companies that are working together. There are a number of universities that are trying to get this done. I actually think we will have these kits sometime this fall. I'm hoping that they will be deployed in a way that they can be most effective, and frankly, in many ways, not only to preserve the health of our communities, but to get us back to work, as Tony has said so articulately. At the end of the day, Christina, until we can get people confident to go to school, to go to church, to go back to work, to bring America's economy into a more vital state, and that's going to take restoring the confidence in the health. And so these things are tightly linked.
Absolutely. Our next question comes from Jesse in California. Let's listen.
I have a question regarding coronavirus vaccines. So I know a lot of people who are anti-vaxxers, and they don't plan on getting the vaccine at all if and when it comes out. So with that being said, what will happen to the economy if a large portion, or if just maybe a small portion of the population decides not to get it? Thank you.
Yeah, Jesse, that's a similar concern that many of us have, myself included. There's going to need to be good consumer confidence that the vaccines that are developed are both safe and effective, and that's going to come from sharing the data. There's going to be all kinds of scientific, medical data that's going to say in tens of thousands of individuals, these vaccines that will come out, and there will be more than one, will be safe and effective. The good news is that in order to get the herd immunity that we need, we don't have to vaccinate 100% of every community. But the truth of the matter is that to get to that herd immunity, we're going to have to vaccinate somewhere between 60 and 70% of the community. Now, some people would say, let the disease progress, and they'd rather naturally acquire the disease and develop their own antibodies rather than get vaccinated. But if you look at the numbers across the United States, we just looked at the 6 million cases, There are about 328 million people last time we counted in the United States. That's about a 2% infection rate. There's a lot of distance between being at a 2% infection rate and being at a 65% infection rate. And don't forget, COVID-19 is about 10 times more lethal than influenza. So there'd be an awful lot of hospitalization and death that would occur if we allowed this virus to progress to herd immunity through natural progression and transmission of the disease. So I think that's going to compel people. I think there will be anti-vaxxers, but I also think there are going to be people that will have the confidence in the recommendations by their own healthcare professionals. So at the end of the day, what most people do is if they have confidence in their physician or their nurse practitioner or their PA or their local pharmacist who says, listen, I got vaccinated, I think you and your family should get vaccinated, I think that most people are going to do that, and I certainly hope that they'll take that advice.
All right, Tony, did you want to chime in at all on the economic impact if, say, we don't see a lot of people get those vaccinations?
Well, I agree with Dr. Go, and I believe in the resiliency of this economy. I think at the end of the day, the economy will rebound. I think, people will have confidence that the vaccine is going to give them some level of clearing their system up, and I firmly believe in the resiliency of this economy. So I think that the businesses are going to come back. I think that we will see growth. Again, I reiterate that it's going to take some time. But I agree with Dr. Gold, and I think that through herd immunity and the number of people that will take the vaccine, that we'll continue to move forward and move in the right direction.
Yeah, most of us want the economy to turn around. I haven't met a person yet who does not want the economy to rebound. It is so important to each of our families' livelihood. So I definitely believe that if we're all in this together, we all do what we need to do, we can get past this virus. But we're all going to have to be in it together. Jill in Indiana, she has a question. She says, we farm near South Bend, and vacation home rentals here are booked. Do you think this type of travel is safer than staying in a hotel? And what happens if you get sick while traveling?
Yeah, so I think the trend has been for more motor vehicle, RV, and mobile home type of travel. I think people have been reluctant to stay in hotels, even Airbnbs and other types of travel relationships. They prefer, for instance, if they're visiting another family or their own family, an extended distance, to try to get it all done with one car trip. There's certainly been a trend away from air travel, although the numbers are slowly rising, and I'm sure Tony knows that. I've been watching airport numbers slowly go up in our community and through a number of the hubs. It's certainly not back to normal, but it is starting to change. But I think, my advice would be to Jill is if you can possibly do this in your car, if you can stay away from hotels. And it's not that the hotels and the motels and the B&Bs are not doing a good job in cleaning their facilities and taking extra precautions, but you just never know who the last customer was. Whereas if you're with a family member who you know has not had the disease, who you know is healthy, particularly if they've been tested recently. And, you'd be surprised how many families are saying, to their parents, to their kids, to their brothers and sisters who they're going to, spend a day and a half in the car traveling towards, have you been tested? Have you been sick? People really want to know, particularly if they've been locked in for 6 months. They don't want to do something that's going to raise their risk. I know when I visited my grandchildren not too long ago, their parents asked me, how long ago was I tested? And I do get tested fairly frequently just because I do get out in the community a good deal. And people do ask me that question. But in spite of that fact, I take every precaution that I can possibly take.
Absolutely. All right, Scott of Arizona is next. He says, my family lives in a town of just 487 people, and I usually don't answer my phone if I don't recognize the area code. Is there a way to distinguish between a contact tracer and a scammer?
So we've been hearing a lot about scamming in the guise of contact tracing. And while there's no sure way to tell the difference, there are a couple of things that we have recommended. First of all, it is very important if you've been exposed to know that. And the only way you're going to know it if you're not having symptoms is if you answer that phone call from a contact tracer. When that call comes in, and it frequently is going to come in from a different area code, particularly if you're in a rural community, you want to have the option to call them back. So what you simply do, as you know, if you're just trying to be safe for any call for that matter, ask for the name, the contact information, and the name of the organization that's calling. And once you have that information, you can call them back, and you can tell pretty quickly whether it's the local public health department or if it's a scanner, because most of the scammers are not going to release that information. Secondly, there is no contact tracing that asks for any credit card or billing information. All of these individuals are either employed by the state or employed by the local public health department or employed by one of our federal agencies. And as a result of that, they're never going to ask you for your Social Security number. They're not going to ask you for your billing information at all. And finally, you know, in terms of as you hear them out, they're going to ask you, first of all, they're going to tell you why they're calling. They're going to ask you for some very specific health-related information. And then they're going to tell you what the rules of the road are in terms of your own need for either quarantine or isolation and any particular testing. And any conversation that goes beyond those areas is not appropriate. And, you know, there are good doctors and bad doctors. There are good plumbers and bad plumbers. There are probably good contact tracers and bad contact tracers. And so we do have to be vigilant. But I think that the scamming stories are very overrated and have created a lot of concern that is somewhat displaced.
Okay, let's go back to the economy for a moment, because when you take a look at the Dow Jones Industrial Average, it's a measurement of the future. It's been in record territory lately, Tony, and so there is some optimism that we will get beyond this virus. I was wondering if you could share some success stories with us.
Well, I think when you look at certain business sectors, very specifically here in Nebraska and across the country, I think when you look at it, I'll use the term anything home. So home improvement. When you look at the gardening industry, when you look at physical fitness equipment at home, when you look at all of the technologies related to work from home, Zoom, all of those sectors have been extremely successful. So I think there's a paradigm shift. I think work from home, school from home, telemedicine from home is creating a technology and a real paradigm shift. I think when you look at digital enablement, those are going to be areas that will continue to create growth in our economy. I think something that is really critically important, specific to what I'll call the greater parts of our state and our country, or the rural parts, is really broadband and high-speed connectivity. I think that is the new highway that will create the infrastructure for growth and innovation. And here in Nebraska, we are really focused on looking at what we need to do for our smaller towns and our smaller cities to ensure that they have high-speed connectivity and it's a stable way of being able to connect to the internet. Fiber to the home is really the most prominent way to do that, but there are other ways to get it, and it's critically important to the economy and the greater parts of our state.
Yeah, and many of us have learned how to do more with less, so it hasn't been all bad news from the virus. Our next question comes from Larry in Tennessee. Let's listen.
Do you guys know how many people have recovered from the virus but never actually took a test?
Yeah, Larry, we don't really know. We don't know how many people have become ill from the virus and were never tested. And more importantly than that, we don't know how many people never became ill, had no symptoms at all, no fever, no cough, no congestion, no loss of taste or loss of smell, but were carrying the virus for 5, 7, 10, 15 days and infecting others. And when you have no symptoms, or when you are minimally symptomatic and don't get tested, that doesn't permit contact tracing. And in the absence of contact tracing, until we have a safe and effective vaccine available, there's no way we're going to stuff this virus back into a box. So I wish I could give you a good answer to that question, but the current estimates by our public health people, you may remember we started off the show and said we're about just over 1.3 million cases, 6.3 million cases wide across the United States. The current estimates are that we're off by a factor of 10. So that would mean there's somewhere between 61 and 63 million Americans that either currently are or have been infected with COVID-19. And if that is indeed the case, that means we're missing 9 out of every 10 people. So a significant number.
All right, we are going to pause for a moment, but we will have more Rural Health Matters with the University of Nebraska Medical Center right after this on a Labor Day edition. We'll be right back. Welcome back to Rural Health Matters. I'm Christina Loren. Joining us once again, University of Nebraska Medical Center Chancellor Dr. Jeffrey Gold. And tonight, we also welcome Nebraska Department of Economic Development Director Tony Goins. Thank you both for joining us once again. Our next question comes from Hudson in Missouri. He says, I haven't seen my 87-year-old grandfather in Kansas for almost a year. Is there any way I can safely visit him for just an hour if I wear a mask and a shield?
So, Hudson, I would say at this particular moment in time, assuming you're healthy and your grandfather is healthy as well, I would still not do it. I think if you're really that desperate, you can visit to wherever your grandfather lives, stand outside the window, FaceTime, connect via the phone. We've seen all different types of solutions, but it's not that it's impossible, and I don't necessarily characterize it as high risk, but you got to think about the consequences. And I guess the best way to frame it is if I had an 87-year-old granddad, I would resist the temptation to do it. Hard decision, but that's where I come down.
All right. Next up is Elgene from Michigan. Her family has had to alter their lifestyle significantly and lean heavily on digital platforms to stay connected. But that's not always easy in rural America. Let's listen.
My concern is the internet in rural areas. Children facing this COVID crisis, families working from home, internet in the rural area really needs to be addressed.
Elgin, I couldn't agree with you more. It's the last mile of internet that is really the biggest challenge that we have across the rural communities of America. And it's not just about doing business, but it's, in this day and age, it's all about web shopping. That's become critically important for food and supplies and other things. It's about being able to order your prescription medications and renew those prescriptions. It's about getting your work from home done, particularly true in the farming and ranching communities, to be able to keep an eye on commodity prices and things such as that level. But also for home health care. We have dramatically increased the amount of telehealth that's been going on across the United States as a result of the pandemic. But the good news is, I would say, and I'm going to ask Tony in a second as to what he thinks, but every year there's more and more high-quality bandwidth that becomes available in rural America. And I know here in Nebraska, we have focused extensively on not just schools and post offices and hospitals and places of work, but actually getting that bandwidth out to the true rural ranching and farming community. Do you have any thoughts on that, Tony?
Yes, I do, Dr. Gold. In actuality, the CARES money that we received, the $1.08 billion, we've allocated 40 million of that for subsidies specific to being able to help our rural cities and towns get connected. It is one of our top goals. I mean, it is really top of agenda. I mean, we clearly understand the ramifications from not having connectivity in the rural parts of our state, but we also understand the upside that if we do, and as you mentioned, telehealth, work from home, school from home, we also think about innovations and how do we stop some of the attrition from some of the rural parts of our state, and being able to keep the young people there. I mean, I had a mayor tell me that his daughter wanted to leave because she couldn't watch Netflix. And so clearly it is really, really important. And I can tell you, I think here in the state of Nebraska, it is top of agenda. It is something that we discuss almost every day. And I would also say that I think it is becoming even more critical, and I think the entire country is focusing on putting broadband and high-speed connectivity across all of the rural parts of our country.
You know, I think, Christina, the pandemic is going to serve as yet another wake-up call for how critical Wi-Fi connectivity really is. And I think it's going to energize the investments, particularly in rural communities, which will come as really good news. So there will unquestionably be good things that have come from the pandemic, and hopefully that'll be one of them.
Yeah, I mean, why would you want to live in a high-rise in New York City where you're paying through the roof just to have that little space when you can work out in the country doing what you're doing right now if the high-speed internet is in place? I think we're going to see a lot of people headed to rural America, which could revitalize many communities. We heard this week about cheap, widely available steroid drugs shown to reduce the risk of death in seriously ill patients. Can you tell us more about that and the promise that holds?
Sure. What I'm sure you're referring to is some of the recent approvals for the use of dexamethasone, which is a commonly used steroid drug, been around for a very long period of time. We understand its role, we understand its side effects, which are few, and it seems to blunt what we call the inflammatory response or the cytokine storm that is typically associated with active COVID infection. And what we've seen, and this graphic demonstrates it well, there are only 2 or 3 widely used safe drugs that are currently available. We've talked a lot on this show about remdesivir, in which we led the national clinical trial, which has demonstrated both safety and efficacy for use in COVID, which is now being used not only in delayed and serious cases, but in earlier cases. And we're now adding to that armamentarium the use of dexamethasone and other steroids. And it does seem to be effective. It seems to reduce mortality. It seems to keep more people off ventilators, shorten hospitalization, etc. And so the combination of drugs like remdesivir that actually inactivate the virus and drugs like dexamethasone that stop the overzealous response to the virus seem to be a good 1-2 punch to try to reduce the mortality. Very exciting addition.
Absolutely, especially because of the affordability. I think that's a big component when you think about anything medically related in this country. Our next question comes from Francie of Oklahoma, and she says, my husband is a 3rd-generation Angus breeder, and this year has been hard on him and our family business. Any idea when we will realistically see an end to this virus?
Well, Francie, I think the virus is going to be around for a long time, just like influenza, measles, mumps, chickenpox has been around for a really long time. It's going to come down to much more of a question of how are we going to deal with it long term, as opposed to whether the virus itself is actually going to disappear and go back to the bat caves in central China. But I think the practical answer to your question, and the encouragement that I'd give to your husband, is we keep getting closer and closer to effective and safe vaccines. We keep getting closer and closer to a group of effective antiviral agents. And we continue to learn more and more about how to diagnose and how to prevent the spread of this disease. And so, if your husband were to say, when are we going to see the end of influenza? I think we're going to be having to face influenza for a good many years to come until we get to a single vaccine and not have to go through annual vaccination processes. I think there's a reasonable chance we're going to get to that same point with COVID, but we will live with it and we'll get our economy restored. We'll be back to school, back to church, back to work, and it'll just become something that we take for granted as we take other infectious diseases for granted. But I wouldn't lose track of the fact that this is not going to be the last pandemic that we're going to see. And the same place that COVID came from, there are other bat caves, so-called zoonotic viruses and diseases in other parts of the world. You know, we're really fortunate in 2014, 2015 that Ebola was predominantly contained in Western Africa. Were that to have spread globally, believe me, we would have been in a lot of hurt there as well. So hopefully the lessons learned from the early diagnosis and treatment of this disease will prevent our having to suffer much from future pandemics as well.
You know, the number one concern that I hear from just about everybody, they're just tired. They're just worn out. They want this to be over. In many cases, they're worn out and they've been at home this whole time. When you think about your position right now, do you feel like part of your job, and I pose this question to the two of you, do you feel like part of your job right now is to give people looking for any sort of good news some comfort?
You know, why don't I start, and then we'll ask Tony to weigh in on that. I think there's a lot of good news here. I think over the last year, you know, it'll be a year in December 31st that we first learned that this virus existed in China, early March that we started to deal with some of the tragic consequences in the United States. But we have learned a ton about coronaviruses in general and about COVID-19 specifically, about transmission, about the biology of the virus, about how to test for it. You know, we started off with very conservative tests that took a long time to process, and now we're talking about point-of-care testing that is both safe and effective and reliable and affordable. We had no effective drugs early on, and now we've got several, as we've just discussed, and more exciting ones in the pipeline. And we're, you know, very close to announcing the scalable distribution of one or more vaccines. And so all of that, I think, is good news. But I agree with you, Christina, that we are tired. You know, I talk to my children, my grandchildren, friends and colleagues all the time. You know, human beings are social animals, and we enjoy and we love our freedom to get into the outdoors, to socialize with others, to do the things that are really important to us. There's a big vacuum around our spiritual life, social events, cultural events, athletic events, etc. And so the advice that I like to give people is just hold on tight. We're coming closer to some of these major breakthroughs, and I am very confident that there's definitely light at the end of the tunnel here. I don't know how far the end of the tunnel is, and I wish I could give you a date certain to say, you know, by November 1st we'll have this, by January 1st we'll have that. You know, we're building this airplane in midair, but we're definitely heading in the right direction. And I think it is torture the airplane metaphor for a minute. I think the altitude is good. I think the velocity is good. I'm very comfortable with the pilots, at least the ones that I am dealing with, and the flight crew. So we just need to hold on tight as we continue on this journey. So Tony, you know, do you have thoughts specifically from, you know, your experience in this area?
I do, and I agree. I think we have to remain extremely optimistic. I often refer to the Stockdale paradox, and that is
one of my favorites.
You
by the way.
deal with the real, and I'll paraphrase here. You deal with the current realities, but you maintain the highest level of optimism. You know, I served in the United States Marine Corps, and there were times that we had real serious challenges, but we never lost faith. We never lost faith in our teammates and our fellow Marines. And I think that as a country, that our country is resilient. I think we have the ability to bounce back. I do agree that a lot of folks are tired right now, but I think at the end of the day, if we stay focused and we keep moving forward, we clearly understand that we're going to have to coexist with this for a while. I think we got to continue to do the things to keep us safe, and that is wearing a mask, social distancing, washing your hands for 20 seconds, all of the things that the CDC has talked about. Those are still critical things that we have to adhere to. But I think we have to get out and in a very safe, controlled manner, we have to do business. I've seen children playing more outside now, and I think that's a real positive that's happened from this virus. I think the other thing are really the technology advances. You know, I know a lot of firms had digital plans on the shelf. They had to pull those off the shelf very, very quickly, so you can clearly see a paradigm shift in terms of what is happening with technology, which long-term will create new job opportunities for our economy and new opportunities for all of our young people that are coming out and moving into their own place in the world.
Wow. Well, thank you for your service. Both of you have such important jobs. You're privy to much more information than most of us. I would ask you, what brings you comfort right now, Dr. Gold?
So I think I've expressed my optimism for the future. If you had asked me what concerns me, what keeps me up at night, the answer to the question is probably nothing, because I don't sleep very much. But I think it's just what you just touched on, Christina, is the fatigue that we're starting to see across the country. And you know, when it's Labor Day, and you know, most of us are used to family gatherings and outings and celebrating the labor movements in our country and the importance of that. And I think we're dealing with all of the stresses of the pandemic. We're dealing with all of the social unrest associated with all of the racial injustice concerns that we are challenged with across our country. We're dealing with, obviously, all of the political concerns moving into the election cycle, which are not unusual for our country, but we're dealing with them at the same time. We're dealing with critical economic concerns as a result of the pandemic. So we have those four different things going on simultaneously, and they are wearing people out. You know, as I talk to people in our community, I hear that constantly. But I will tell you this, I also speak to our students who are back on our university campuses. I speak to our faculty. I speak to the doctors and nurses that are caring for patients in our hospital system every day. And I speak to the patients that have been cared for. And we're up to almost full capacity in our healthcare system, which is really wonderful, the confidence that people have. And they are feeling safe. They are feeling confident. They are very much looking forward to the future, and they very much appreciate, you know, reliable, truthful, scientific-based information that's shared to maintain that sense of confidence. So, you know, as I say, I get up every morning and look at the day and say, wow, today's another day to try to get this right, and we will. So I'm feeling pretty good about it.
How about you, Tony? What brings you comfort when you look at the long-run economics? You know, studying economics, it's all about the long run that really matters. What is bringing you a glimmer of hope right now?
Yeah, I like the term glimmer of hope versus comfort, because I can't say that anything is bringing me comfort right now. But again, as I stated, I do remain optimistic. I see growth in the technology sector. I see growth in the trade sector. I see growth in the healthcare sector. We work for a governor who's a pro-business governor. He cares about our citizens, but he also cares about our economy. And so we continue to look at our position from an international standpoint. We're continuing to have conversations about trade. We're continuing to have conversation about business expansion. We are seeing business expansion here in our state. And we're continuing to have conversations about other places and businesses moving to the state of Nebraska in order to strengthen our economic condition. I think the other thing that I'm optimistic about is really the innovation that I've started to see from our citizens and from citizens really around the country. You know, I think during times of challenge, people start to rethink the way they do business. They start to rethink and retool their processes. They start to hunker down and get more efficient. They start to look closer at their financial, their whole financial situation. I mean, their balance sheet, their P&L, and their cash flow statements, and start to find ways to become more efficient at what they're doing. So I think, you know, that in the long run will help make us even stronger as our consumers start to become more confident in visiting establishments and spending money. All of that long term will help to help our economy bounce back.
I thank you both for that candid moment. I really appreciate it. You offer us hope based on your train of thought, how you got there. Thank you so much for that. We have more to come on Rural Health Matters. Stay with us. We're going to pause for a quick break, but we'll be right back. We're glad you're with us on this Labor Day. Welcome back to Rural Health Matters. I'm Christina Loren. Joining us once again, University of Nebraska Medical Center Chancellor, world-renowned Dr. Jeffrey Gold. And tonight, Nebraska Department of Economic Development Director Tony Goins joins us on this Labor Day. Our next call is Colleen from Florida. Let's listen.
Thank you so much for taking my call. I was wondering, when the virus eventually passes after vaccines are developed and people go back to work, what do you think some of the lasting effects you anticipate for our economy? Thank you.
Yeah, Colleen, I thought you were going to ask about what are the lasting medical effects, but as far as the lasting effects of the economy are concerned, certainly something Tony should weigh in on, but I think the economy is going to rebound. I think we're going to find whole new sectors of the economy that we really haven't seen, and I think some of the digital sectors, think digital retail, digital services, etc., I think people are going to get used to that and decide that they like it. And I think there's going to be a shift into that direction. But you think there are going to be long-lasting effects, Tony?
I do, and I think those effects are going to be extremely positive. I will say that I do think that there needs to be a real level of retraining, because there's certain industries that are going to constrict, and there's certain industries that are going to grow. And that digital and that technology sector is going to grow. Here in Nebraska, we are working with our community college, 6 community colleges, and we've allocated scholarships around retraining. So we're looking at those industries that have constricted, and we are moving them into these certificate / programs that allow them to have internships and apprenticeships. But these are in the high growth sectors specific to our economy, and those sectors are technology, the trade, and healthcare. So I think long term, there will be very, very positive indicators based on the movement of our economy and the new sectors that are being created.
You know, I think, Colleen, also that given all the work from home that's been shifted, I think some of that's going to be permanent. I think we're going to realize that the effectiveness of work from home is quite high, and that you can get good productivity while maintaining a work-life balance. So I think that's going to be another major factor in, frankly, mobilizing a new component of the workforce that otherwise could not have been available to help us produce and restore the economy.
All right, thank you for that question, Colleen. We were talking about COVID-19 and some of the negative impacts, the lasting impacts that we're learning about. And Dr. Gold, we're hearing more about how it can impact the human heart. Can you tell us more about that?
Sure. So we are starting to see, and this has been known since the very beginning of the COVID pandemic, some what we thought were short-term impact on the heart. And what I mean by that is decrease in the efficiency of the heartbeat and irregularities of the heartbeat, or what the cardiologists would call arrhythmias. But there's been some research recently, and the data shows that some of the coronavirus's most important damage is actually inflicted on the heart muscle itself. There was a study that was reported in the Journal of the American Medical Association back on July 27th that looked at approximately 100 individuals who had not terribly severe but moderately severe cases. Most of them were not actually hospitalized. They had an age range between 45 and 65, and importantly, they did not have any pre-existing cardiac disease. And they did a series of scans, MRI scans, magnetic resonance image scans on these individuals, and they found a very high percentage, about 7.5 out of 10, almost 8 out of 10 individuals had scan evidence of swelling, what we call edema of the heart muscle. And another, even slightly smaller group, had evidence of inflammation, which is viral changes in the heart muscle. So these are people who have no symptoms, are 2 to 3 months out from the infection. And so this is just an example of what we call the subacute phase of the disease. So these are people who probably all would have tested negative for coronavirus disease. They almost all would be feeling well, ready to go back to school, ready to go back to work, and yet have this underlying cardiac disease. Now, we know this type of cardiac disease, which is known as viral myocarditis, does tend to get better. We know that it can be treated, but we also know that you want to make sure that you diagnose it in a timely fashion. Sometimes it takes medications, and it certainly takes a change in exercise patterns and overall activity while your heart is healing up from this kind of damage. And so I guess there's some warning signs out there that even though we may get to a state where we have an awful lot of people, hundreds of thousands, soon to be millions, who have actively recovered from coronavirus disease, that we want to be sure that all of them have recovered. So their heart, their blood vessels, their kidneys, etc. So just a little bit of a warning for our audience tonight.
Absolutely. Our heart health is critically important. Heart disease, the #1 killer of men and women in this country. Tony, when we looked up the job description for the Director of Economic Development for your state, the answer merely says to grow Nebraska. I love that explanation, but can you tell us more about what that means and what it looks like in this era of COVID-19?
Well, I get the pleasure of serving this great state, and as the governor has asked me to do, I get to be the chief salesperson for the state. So what does that mean? It means that my job is to focus on increasing tax receipts, and we do that through a few drivers. I think the first driver is how do we expand current businesses and how do we support employment and creating great jobs for our citizens based on the businesses that are here in the state. That's number one. Number two, how do we look at acquisition? And that acquisition is based on how do we look across the country and really articulate the value proposition of living and doing business in our state. And we do is competitive. We look at recruitment and how do we bring companies and firms from around the world, not just the United States, to the state of Nebraska. And then we look at our trade and we look at how do we support our farmers and ranchers in terms of exporting those commodities to other parts of the world. We say here in Nebraska, we're the middle of everywhere. We're not the flyover state, we're the fly-to state. We feed the world, and all of those in combination help to create great paying jobs and a great place to live, play, and work for our citizens. So at the end of the day, I work with a great team at the Department of Economic Development. We have some really seasoned veterans that are there. They do a wonderful job, and together we get to serve the state and serve its citizens in terms of growth and really creating a great place to live for our citizens.
Yeah, Dr. Gold loves living in Nebraska, and he came from New York, so that says something right there. A big part of Nebraska's economy is directly correlated with the University of Nebraska football. What is the situation with Big Ten sports postponed until at least the new year? And what measures are businesses taking to try to mitigate that situation?
Well, I'll let Tony respond to the businesses, but from the university perspective, clearly everybody would much prefer to have all of our fall sports fully attended. You know, we've had sold-out games going back to the 60s. If you look at our volleyball team, national champions year after year after year. Hockey, baseball, just, you know, wonderful championship level at the college competition. And these are gaps, and these are economic gaps for us, but they're also, you know, what it means to have a full university life. And so we are working on all of our campuses, all of the different divisions we compete with, all of our teams, to do our best to work closely with our student athletes, with our trainers, with our coaches, and to try to plan what it's going to be to get these teams, to get these sports back and activated. And of course, football is not going to look like basketball, and basketball is not going to look like hockey, and hockey is not going to look like volleyball, of course. And I don't just mean the sport, but I mean the type of protections that are going to be necessary to do it safely and to engage with our audience. But I am optimistic because if you look at what the NHL has done and what the NBA has done, if you look at what Major League Baseball has done, albeit not perfect, they have been able to restore competitions and produce a good deal of engagement with the media and with their audiences. And so we're working very hard, sport by sport, to try to bring that back as rapidly and, of course, as safely as possible. Now, from an economic perspective, I'm going to leave that to you, Tony. Do you have any thoughts on what we can do to help out some of the industries that are tightly wrapped around the athletics?
Well, let me say this. I don't think that there's really any way to really mitigate the fact that we're going to lose a lot of revenue from not playing football on Saturday. So that's just the brutal reality of where we are. I do think that our businesses are really going to hunker down and look at ways to be innovative. I know that there are some bars that are going to start to show some of the Husker games from the past in order to try to create some...
Hopefully just the winning games,
The
right?
winning games, that's right, that's right. To try to create some enthusiasm. But all of the business leaders, listen, we're going to have to... We have a theme here called Locals Supporting Locals. And you will see a continued campaign from the entire business community to support the local businesses that are in the Haymarket, because that's where the majority of the revenue would be generated during a football game. And so you can't take away the fact that we're going to lose the revenue. The only thing we can do is try to minimize the losses until we can get the sports back, and we hope that that comes back pretty quickly. And we'll hold on and make sure that we just stay the course until we can get our sports back in some form or fashion.
Okay. Now, in honor of Labor Day, what can rural Americans do to help each other most in this moment, at this juncture, both economically and medically?
Well, I'll start off, Christina, and first I want to wish everybody the very best of a safe holiday and to really celebrate what Labor Day means to all of us. My best and most sincere advice would be to our audience is to take care of each other, communicate with each other, engage with each other. Call your family, call your friends, FaceTime, Skype, whatever the medium might be. Send a message to somebody that you haven't interacted with recently. Tell them that you care. We're all in this together. We are on a journey that's got a definite end to it, and we're going to get through this and come out stronger and better. I'm completely committed to that, but we need to continue to rely on each other. So my best holiday advice is just depend on each other, make that extra phone call or email, and just say thank you for everybody that's working so hard to get through this.
And Tony, should we just continue to support our local restaurants and do what we can to help those who are struggling right now?
Well, you really took the words out of my mouth, because that's exactly what we need to do. I echo Dr. Gold's sentiments, but I also say that we have to support our local restaurants. And if you don't go out, if they have outdoor seating, I would encourage you to use social distancing, but you got to support our local restaurants. And if they have delivery services, then I would encourage you to get on the internet, get food delivered. Our local restaurants are the backbone of our economy. They employ a lot of people, and I would say enjoy your Labor Day weekend, but support your local businesses in your communities.
Absolutely. Whenever you go to a restaurant, you're also supporting a farmer or rancher in this great nation. I just want to thank you both so much for spending some time. Thank you for spending this Labor Day with us. UNMC Chancellor Dr. Jeffrey Gold and Nebraska Department of Economic Development Director Tony Goins. Thank you both so much. Remember, you can catch Rural Health Matters every Monday at 6 Eastern. If you want to leave us a message with your question, 855-776-6147. We'll see you next Monday. Wishing you and your family a beautifully blessed Labor Day evening.